Hello, Dr. Reddy. How are you today?
All well, Nivedita. How are you?
I'm very well, thank you.
Good,
So
good.
I thought of, sharing some thoughts with you today on endometriosis.
Okay.
So,
I hope those thoughts are not too difficult for me to answer.
no, not at all.
Okay.
So, what is endometriosis?
So, endometriosis is a condition in which tissue similar to the one lining the womb or the uterus is found outside the uterus. And these can be places like the ovaries, the tubes, sometimes as far as the lungs or the motion area, what we call the rectum, and sometimes also in scars of previous surgeries, especially cesarean sections. Yeah.
And what symptoms do we have when we have endometriosis?
So, before we go to symptoms, I'd just like to talk a little bit about how many women in this country suffer from endometriosis. It's estimated that about 30 million Indian women suffer from endometriosis. And in the metros, it can be found in about 30% of women, usually in the ages of about 30. So they're mainly young. It's also supposed to be a disease of the so-called civilized world. And interestingly, the more affluent seem to have this. Coming back to what do women suffer from? So there are two categories of women. Women who have symptoms and the lucky ones who have no symptoms. So women can have endometriosis but find that they have no symptoms at all. And they wouldn't know they have endometriosis unless they have, say, a laparoscopy for some other reason. The women who actually have symptoms can have chronic pain. This pain could be associated typically with their periods, before their periods and during their periods. Sometimes it can also extend beyond their periods, depending on how severe the whole situation is. Now, apart from pain, they can also have ovarian cysts. A cyst is a collection of old blood, well, old blood in the case of endometriosis, in the ovaries. And this can give rise to pain or large tumors in the tummy. And some women may present for the first time with an inability to conceive because of endometriosis. Yeah.
And who are the women who are at risk of endometriosis?
So, one of the things about endometriosis is we don't really know what causes endometriosis, but we do find a certain pattern. It can run in families, it can run in women who have prolonged periods, and it can also happen in women who've had surgeries, as I mentioned, cesarean sections. So there is a strong genetic or a familial component in which your sisters, mother, or aunts can have had endometriosis.
And lastly, about the treatment options. Should they be worried? Is it something that will turn into cancer?
So to answer your second question first, very rarely does endometriosis turn into cancer. Should they be worried about it? Obviously, if they are distressed by the pain, they need to seek treatment for this. And treatment is both medical and surgical. With medical, the treatments that we do give are one, painkillers, two, hormonal drugs in order to modulate this, to stop periods for some time so that the endometriosis doesn't grow. Endometriosis typically grows with estrogen, which all women have in their bodies. And there is also a device, an intrauterine device called Mirena, which is used for endometriosis. And with regard to surgery, we have to deal with the cysts or what we call adhesions, where bowel and the uterus can get stuck in order to release this. But the best thing would be to seek help, especially if you have pain before your periods, during your periods, which has been going on for some time, and obviously women who are trying to conceive.
Right. Yeah. So don't ignore your symptoms. So basically.
Yes, don't ignore your symptoms. Not everybody has endometriosis. And even if you do have endometriosis, as we discussed, there is always something there to help you out.
Right. Yeah. Thank you.
You're welcome.